Assalamualaikum
warahmatullahi wabarakatuh.
Perkenalkan, saya Syabilla Syfa dengan NIM F1C4230558.
Nama saya Tantri Wiranti dengan NIM F1C422030.
Nayla Rafida dengan NIM F1C423012.
Nama saya Nayla Attahiya dengan NIM F1C423004.
Di sini kami ingin menjelaskan tentang transplantasi organ.
Transplantasi organ adalah proses mengganti organ yang rusak dengan organ sehat dari donor untuk menyelamatkan nyawa dan meningkatkan kualitas hidup pasien.
Transplantasi organ merupakan proses mengganti organ yang rusak dengan organ sehat dari donor. Sebelum transplantasi, dicari donor yang cocok berdasarkan golongan darah dan kecocokan jaringan agar organ tidak ditolak tubuh. Pada gambar ini, pendonor mendonasikan satu ginjal yang sehat pada pasien yang terkena gagal ginjal. Ginjal yang sehat ditanam dalam tubuh pasien, lalu ginjal disambungkan ke pembuluh darah dan kantung kemih.
Terdapat dua tipe transplantasi organ. Yang pertama itu transplantasi autologous atau disebut juga autograft, adalah organ atau jaringan yang diambil dari tubuh pasien sendiri lalu dipindahkan ke bagian tubuh yang lain. Transplantasi allogenik merupakan transplantasi sel punca atau sel induk dari seorang donor yang berbeda dengan pasien. Sel punca ini digunakan untuk menggantikan sel punca yang sakit atau rusak pada pasien. Donor bisa berupa kerabat ataupun orang yang tidak terkait.
A regular primary kidney transplantation into the right iliac fossa is shown. Some technical details are provided that may require basic surgical and anatomical knowledge. The procedure starts with opening the skin in the lower abdomen with a surgical knife. The hockey stick or oblique incisions are most common. The length of incision depends on the habitus of the patient and ends 2 cm above the pubic bone, which allows access to the retroperitoneal space, the iliac vessels and the bladder. The subcutaneous fat is incised using electrocautery. The fascia of the external oblique muscle is incised diagonally. The combined fascia of the internal oblique and transverse muscles is incised in a more vertical fashion. The preperitoneal space is exposed, and the inferior epigastric vessels, as well as the rotund ligament in females or spermatic cord in males, are identified and secured with a vessel loop. The lowest part of the posterior rectus sheath is incised. After this, the retroperitoneal space is reached by gently pushing away the peritoneum. Its contents are held by a retractor. The common external and internal iliac artery and vein are identified and dissected from fatty tissue and lymphatic tissue to make clamping of the vessels possible. The iliac arteries are investigated by palpation for atherosclerosis. The kidney is now retrieved from cold storage. In this animation, it has already been prepared for transplantation and pre-transplant biopsy has been taken. Corner stitches are applied to the renal vein edges. The kidney is placed into the iliac fossa in the best possible position, and the length of the renal vein and artery may need adjustment. First, the vein-to-vein anastomosis is done. If needed, the iliac artery is retracted very gently to improve access. The iliac vein is clamped and cut, and the incision is extended. A supporting pull-out stitch is placed on the medial side to keep the lumen open. A heparin solution is used to rinse and clean the lumen from blood and small thrombotic material. The renal vein corner stitches are connected to the corners of the opening of the iliac vein, and from one corner the venous anastomosis is performed, in general by using a 5-0 unabsorbable monofilament running suture. The supporting stitch is removed and both remaining sutures are knotted. Next, the iliac arteries are clamped. The artery before bleeding, the common iliac, is incised and the opening is enlarged using a 4 mm aortic punch. The artery is cleaned with heparin solution. The arterial anastomosis is now performed using a parachuted 6-0 unabsorbable running suture.
Sekian video presentasi dari kelompok kami. Mohon maaf jikalau ada salah kata dari video ini. Wassalamualaikum warahmatullahi wabarakatuh.